Alright guys, welcome back. Today we'll cover cardiac output, some things that influence cardiac output, stroke volume, preload, and afterload. So we'll get right into it here. First thing we'll cover is what exactly is cardiac output. Okay, so cardiac output is the volume of blood that is ejected from the left ventricle each minute. This is the volume of blood ejected from the left ventricle each minute. Now, a normal range for cardiac output is going to be somewhere between 4 and 8 liters per minute. Okay, and how we calculate this, the formula for it's pretty simple. It's cardiac output is equal to heart rate times stroke volume. Okay, so you're probably saying you know what heart rate is, so now in order to understand this formula, we have to understand stroke volume. So stroke volume, this is the volume of blood that's ejected from that left ventricle each beat. So focusing right over here, this left ventricle. So this is volume of blood ejected from the left ventricle with each heartbeat. Okay, and a normal stroke volume is going to be equal to 60 to 100 milliliters per beat. Well, it's each beat, so you don't need to put per beat. 60 to 100 milliliters is a normal stroke volume. So if we just do a quick example here for your cardiac output, so let's say we know a normal heart rate. Let's just 60 to 100. We'll make the math easy, right? So we'll do 100 beats per minute times a normal stroke volume, 60 to 100. We'll say 60 mLs. So 60 times 100, that is going to give us 6,000 mLs per minute. And now we know that cardiac output is measured in liters per minute. So 6,000 mLs per minute, that is equal to 6 liters per minute, which is right in the middle of our range. That's perfect. Okay, now to understand this more, we need to look more into the stroke volume concept. So there's a few things that can, there's really 3 things that can influence stroke volumes. We'll cover them here. The first one I want to talk about is preload. Okay, so the easy way that how I think about preload is the volume of blood that is going to fill the ventricle when the ventricle is at rest or during diastole, right? This is volume of blood that fills the left ventricle during rest, also known as diastole. And I know I'm saying left ventricle here. I mean, technically it's the volume of blood that fills, it could be the right ventricle as well. But for this video, these concepts, it's easier just to focus on one side of the heart. So focus on the left ventricle and to make it a little easier to make sense. Okay, so it's the volume of blood that fills the left ventricle during rest. That's how I like to think about it. Makes it a little bit easier. Technically, it is the stretch of these ventricular walls here. So technically, it's the stretch of ventricle walls during diastole, so as the heart's filling, which these, both correlate with each other, right? The more volume you get, the further stretch you're going to get. So I think, to me, it's just easier to think about it as volume of blood filling the heart. But anyway, so preload here is going to have a direct correlation with stroke volume, right? So because the more blood that fills this ventricle, the more blood that's going to be ejected. So we know more ejected blood is going to lead to an increased stroke volume, because we know that is what stroke volume is measuring, right? And an increased stroke volume is going to lead to an increased cardiac output. So that has a direct correlation there. As far as the next thing we'll cover, next one is afterload. And so afterload is the resistance that this left ventricle must overcome in order to pump blood into the aorta here. Okay, so I'll write that down. So this is the resistance the left ventricle must overcome to pump blood into the aorta here. Okay. Now, the afterload can be influenced by a few things. You'll see, like with an increased afterload, if you look here, this aortic valve, maybe like aortic valve stenosis would lead to an increased afterload. Anything that causes vasoconstriction is going to increase your afterload, and then decrease can be just opposite, right? So vasodilation will lead to a decrease in afterload. Now, afterload is going to have an inverse relationship with stroke volume, right? Because an increased afterload is going to mean less blood. Increased afterload means more resistance, so less blood is being ejected out of the ventricle. So if less blood is being ejected, it's going to be a decreased stroke volume, which is going to lead to a decreased cardiac output. Okay, the third and final one here we'll cover that influences stroke volume is going to be contractility of the heart. Let me write this better. Contractility. I feel like this one is pretty self-explanatory. So contractility, this is, just think of this as squeeze of the ventricle. A stronger contractility means there's going to be a stronger squeeze, more blood is going to be ejected out of the ventricle. It's going to lead to an increased stroke volume, increased cardiac output, and then vice versa. Decreased contractility is going to lead to a decreased stroke volume and a decreased cardiac output. One thing I did forget to mention here, so if we're correlating preload with diastole, then so afterload here, resistance left ventricle must overcome to pump blood against the aorta. So this is systole, right? When that ventricle is contracting. So just to correlate those two together. But that was just a quick overview there of cardiac output, preload, stroke volume, afterload. So hopefully you can kind of see how that all ties in and influence each other. If you have any questions, please let me know in the comments. Thank y'all for watching, and please like and subscribe. Thank you.